Rhys Hibbert's operation marks a significant moment in the development of artificial intelligence inside the operating theatre. The 48-year-old father of two and customer services manager from England's Bedfordshire became the patient in what was described as the world's first live AI-assisted brain surgery to remove a tumor. The importance of the procedure is not simply that AI was present in the operating room. The technology was actively analyzing the surgery as it happened, providing surgeons with real-time information during a complex procedure involving some of the brain's most sensitive surrounding structures. Hibbert's medical journey began 18 months earlier when he unexpectedly fell unconscious and suffered a seizure during a lunchtime walk. Until then, he had been fit and active. A brain scan revealed an 11mm non-cancerous tumor growing on his pituitary gland, a marble-sized organ located at the base of the skull. Despite its relatively small size, the tumor's position created serious problems. The pituitary gland sits directly next to the carotid arteries and optic nerves. As the tumor pressed against Hibbert's optic nerves, his peripheral vision narrowed, causing him to trip. He was also experiencing severe fatigue and dizziness. The surgery was performed at the National Hospital for Neurology and Neurosurgery by University College London Hospital neurosurgeons Professor Hani Marcus and Mr. Daniel Khan. To reach the tumor, the team inserted a thin camera, known as an endoscope, through Hibbert's nose and navigated towards the base of his skull. The tumor was hidden behind bone and tough membranes, while vital arteries and nerves lay extremely close to the surgical area. The procedure carries considerable risks. There is normally a 25% to 50% chance of failing to remove the entire tumor and a 0.5% to 2% risk of damaging a major blood vessel, with individual anatomy varying between patients. To help manage these challenges, the team used a bespoke AI assistant funded by Google and the National Institute for Health and Care Research. The system analyzed the live video feed from the operation in real time on a second screen. It tracked surgical instruments and highlighted the exact locations of hidden blood vessels and nerves, helping surgeons better understand the anatomy surrounding the tumor. The AI could also advise the team on safer areas for removing tumor tissue. Trained on hundreds of annotated videos of pituitary tumor removal procedures, it was designed to recognize complex anatomical structures and act as what researchers described as an expert second pair of eyes. The key point, however, is that the AI did not replace human decision-making. Researchers stressed that the technology was purely assistive, while the surgeons retained full control over every surgical decision. The system provided additional real-time analysis, but the medical team remained responsible for interpreting that information and carrying out the operation. In that sense, Hibbert's surgery demonstrates a model in which AI supports surgical expertise rather than taking over the surgeon's role. The result was a complete success. Immediately after waking, Hibbert felt that his peripheral vision had returned, describing the sensation as 360-degree vision. Over the following 8 weeks, his eyesight continued to improve, his energy returned, and all of his pre-surgery symptoms disappeared. This landmark procedure shows how AI can be used during a live operation to provide surgeons with an additional layer of visual guidance, particularly when they are navigating around hidden nerves and blood vessels. In this case, the AI's role was clear, not to replace the surgeon, but to provide another set of eyes when precision matters most.